On the track, I am Gabby Thomas, who's an athlete, and I am trying to win gold medals. I have this love for my well-being and health and fitness, and a lot of what I have learned in track and field has definitely crossed over into my passion for healthcare. My siblings and I always had access to healthcare. I mean, it's something that we kind of took for granted. I didn't realize how much of a privilege that was growing up.
We are seeing people who don't have insurance. It could be that they work in low-paying jobs that do not offer insurance. It could be people in between jobs. The demand for our services has never really gone away.
My introduction to healthcare disparities began in college, when we talked about things like the Tuskegee syphilis study, Henrietta Lacks, and social determinants of health. For someone like me to not be aware of racial disparities in healthcare was mind-blowing to me. I needed to know more about this and see what we could do to help.
Gabby Thomas is amazing. She has been heading our hypertension control project.
Some of the issues that we see often are lack of access to nutritious diet. Sometimes they don't have consistent access to a kitchen, or they don't live in an area where there's healthy food options surrounding them. If you work long hours or have a really hard and demanding job, it might be difficult to make it home in time to cook. They struggle to find time to exercise, and fitness is a really big part of health outcomes. The program that I work with helps them address those barriers. We are improving access to their healthcare by following up with them consistently. When you have people who genuinely care about you and your health trying to make it easier for you, it alleviates some of the stress that goes along with going to get healthcare.
And it's not just providing medical care, it's providing peace of mind. It's letting people know they have somewhere to turn for care. And we're able to do that for them because we have wonderful volunteers like Gabby.
I want to continue to use my platform as an athlete to speak about it. Also continuing to have these conversations with physicians, nurses, administrators, and making sure that they are taking health inequities into account when they are treating patients. I'm not concerned about how many medals I'm going to win at the end of the season, but I'm concerned about what difference I'm making in the community.